So I found a YouTube video in which Plume's co-founder and chief medical officer blatantly misleads its clients and potential clients when talking about testosterone therapy. Now, Issac Uncooked on YouTube did a breakdown of this, and I'm going to link that below in the descriptions. And I please encourage you all to go watch that because Isaac breaks down some very good points. Now, I'm also going to be showing these Q&A questions and giving my own commentary. I'm also going to be referencing normal informed consent papers that anybody signs for testosterone therapy. Let's get started.
I'm Jarek. I go by she, her pronouns. I'm the chief medical officer and co-founder of Plume.
And another question, should I be concerned about how tea can affect my mental health behavior, particularly with pre-existing mental health conditions? If so, how?
Yeah, I think first and foremost we see that tea and gender-affirming hormone therapy, gender-affirming care, broadly speaking, in most cases can have a really positive impact on our mental health. But to say like, oh, it's going to do this or this, it's really hard to say that. But I'd say like on the net, generally speaking, it's usually going in the positive direction. Certainly don't have the data to say things like that haven't been researched specifically. If he does.
So this is blatantly misleading. Yes, in some cases can testosterone therapy help your mental health or increase your mental health? Yes. However, on every informed consent paper that you sign for testosterone therapy, there's a section about this in which it says possible worsening of depression, bipolar, schizophrenia, and psychotic disorders or other unstable moods. And there are plenty of studies and research to show that this does happen, that testosterone therapy can cause issues with people who have depression, bipolar, schizophrenia, and psychotic disorders or other unstable moods. It says it right there. You have to sign it in order to take it. I'm not really sure why they wouldn't specify that in this when answering this, but okay, let's move on.
Does having an IUD or being on other hormonal medications like Accutane and birth control interfere with tea?
No. Easy one. But the cool thing is they'll still work, right? So they still get the contraceptive benefit.
Now they're asking if being on birth control or IUDs and stuff like that can affect T. Now I don't personally have a lot of knowledge about this personally, but I'm just going to read off an informed consent paper as I just did because there are certain parts that reference this in some way. Possible loss of fertility. You may not be able to get pregnant after being on testosterone therapy for some time. How long this might take to be permanent is unknown. Testosterone is not reliable birth control. However, even if periods stop, you can get pregnant if you are having penetrative sex with a natal male partner. If you do get pregnant while taking testosterone, the high levels of testosterone in your system may cause harm and even death to your developing fetus. Other effects of testosterone on the ovaries and the developing eggs are fully not known. Yeah, I mean, definitely if you're going to be adding more hormones, I'm sure it has some effect, and the fact that they're just going to sit here and say it has no effect is ridiculous. Let's move ahead to the next question.
The effects of tea on my uterus if I don't have a hysterectomy? Are there any serious long-term effects?
Yeah, and I'll also preface this by saying, so for this talk, you'll probably hear words like that, right? We're going to use some anatomical terms, and these might be words that might be triggering for some, and might be ways that don't necessarily describe your body, but we'll use them for the case of clarity, kind of specificity, but acknowledge that these terms can be gendered, although we'll keep it very, very anatomical and specific. As far as effects on the uterus, so this is interesting. Actually, it was just at the WPATH Global Health Conference they have every couple years a few weeks ago, and they presented a couple papers on research looking at this specifically. And so it's an area where we're getting more information, and what we're seeing is about half of people on testosterone have what we call a proliferation within the uterus, or the lining of the uterus, and about half have atrophy of the lining of the uterus. And so it's not, I think before we're like, oh, well, if you're on testosterone, then the lining of the uterus is going to thin or it's going to atrophy. And when I say uterus, we're talking about internal body parts here, right? But in fact, that's not actually the case. So about half will, half won't. What they also saw is that it didn't really matter. There was those who had the proliferation or increased lining even while being on T. And in those individuals, they didn't necessarily see any bleeding or breakthrough bleeding or issues with that. So it's kind of, it's just one of those things. We can't always totally explain the direction the body is going to go, even if we can theorize based on the expected physiology. Like a lot of people ask about, oh, can it cause cancer, that kind of thing. No evidence to show that testosterone causes uterine cancer or ovarian cancer or any other types of cancer.
So this is quite obviously an insane claim. He says it doesn't increase the rates of uterine cancer, doesn't increase the rates of ovarian cancer, doesn't increase the rates of any other cancer. We have literally thousands, I recommend you go look them up, of studies on this, and they show a completely different story. Some of them sort of agree, some of them definitely disagree, some of them show a causal link. I'll just read you a conclusion of one study. Preclinical experiments have further suggested that AR activation correlates with the induction of ovarian tumorigenesis and cancer progression, as well as chemoresistance in ovarian cancer. Here's another study. Again, there's thousands of these, but I'm just going to bring you two. Ovarian cancer is the most fatal gynecologic malignancy. Androgen supplementation in this population may be associated with an increased risk of both ovarian cancer and of endometrial cancer. So I don't know what he's talking about.
And I should also say, and really no evidence of long-term damage, if you will, or effects when it comes to those body parts. Now,
what would cause the need for a hysterectomy? Is there ever a need for that?
So never what we'll say like a clinical need, meaning that testosterone would cause a change in your body that would require a hysterectomy.
So a couple of things there. Now I allowed Isaac to talk on that because he obviously had the proof right there to show that there are studies linked to testosterone therapy and ovarian cancer. So I just wanted that to be out there. There are many studies. You can go ahead and look them up yourselves and see that that is caused. Before that, they're asked about atrophy and talking about atrophy, and he's saying 50% of clients get it, 50% don't, and that's bullshit. He can say it's from WPATH all he wants. I haven't seen it. And every trans guy I know has atrophy. Atrophy is normal if you're on testosterone therapy. It's completely normal, and it happens to all of us. And to sit here and say that there's no reason or no medical reason for being on testosterone that you would need a hysterectomy is actually ridiculous. Almost every single transsexual man on testosterone therapy will have to have a hysterectomy at some time in their life due to atrophy. It's on the informed consent. Not in this detail, but it's on the informed consent. This is a problem within the community. Nobody talks about it, and I cannot believe that Plume's chief medical officer just came out and said that there would be no reason for that to happen because it happens all the time. Let's move on.
How does T exactly stop the period in the body, the menstrual cycle from happening?
Yeah. So it's another one of those where I probably don't totally know. Now, what's interesting though is that estrogen levels can vary when you're on testosterone, and in fact, that's why we don't check estrogen levels. Now, over time, they'll probably go down because again, the body says, "Oh, I have testosterone in it, so I don't need to make estrogen." Same thing when we give people a lot of estrogen, right? Like in my case, and it's like, "Oh, I don't need to make testosterone."
So as you can see, they just said that they can't tell you why periods stop because of testosterone therapy. There's also plenty of studies on that. Go ahead and Google it and check it out. But the fact that they said that they don't check the estrogen levels is seriously horrifying. Horrifying. You have to have both of those levels checked. You have to have your testosterone checked. You have to have your estrogen checked. You have to have normal lipid panels ran normally, all the time, to make sure that your levels are okay. Your estrogen level is actually very important as a transsexual man. Extremely important. I know this from personal experience. My estrogen was extremely high for the first couple of years. And sometimes if you're on, which this isn't what happened to me, but this is common, sometimes if you take too much of a dose or too high of a dose of testosterone, the testosterone can convert back to estrogen. So you want to be testing your estrogen to make sure that that's not happening, or to make sure that there isn't something else going on with your estrogen. Now, I personally had to go on estrogen blockers because my estrogen was too high in order to bring it down to a male range. And that worked for me, but that still not doesn't work for everybody. But you can't sit here and say that. Like, you literally cannot say that. Let's move on.
At what level do you increase dosage of tea, and what is the maximum dose someone can take?
So again, this is really going to come down to personal goals. What I always say is we never treat a gender identity. We just treat to a patient's goals. Because somebody who's non-binary might want to be on, just as much testosterone as somebody who identifies as man. And so we really just focus on those goals. And so that's going to determine that, right? In terms of how much testosterone we're using, and in terms of max level, so we use this range, as some of you might have seen, like 400 to 800 when it comes to the testosterone level as measured in the body. And what this comes from is the levels that we typically see in folks who have testosterone predominant bodies, and of course have physical changes that many folks are looking for. So that's where that comes from. It's plus or minus. If somebody has a level of 850, it's not like you have to suddenly change your dose, or 900 or even 1,000. We're looking at the picture holistically. And so meaning, okay, what is your progress like? How are you changing? Like, you want to change? Are you feeling good? Some of the more like medical stuff, like what are your other levels? So we look at things like your blood cell counts, to make sure that that's not going too high, because testosterone can make your red blood cells go higher.
So what they pretty much just said here was that you can come in and choose whatever dose you want and have that prescribed. You can talk to a doctor and say, hey, I'd really like this dose, and that'd be cool. Could you do that for me? No problem. I'm not saying that you can't base something on goals. I do understand microdosing testosterone, and that some people who are non-binary do that. However, the normal dose of testosterone is pretty common, but it does have to be determined by each person's body and how their body reacts to the testosterone. You don't just take whatever somebody comes in and says, hey, I really like these changes happen super fast, so give me a high dose of testosterone. And they're like, okay. Because that's pretty much what they just said there. They literally said that. Right, here we go.
Are there strategies for improving bottom growth when on a lower dose of tea?
Whether applying it topically or locally to that area we don't really know at this case, or at this point. And it's certainly okay to try that.
So with absolutely no data and no research, you're telling transgender, transsexual men to go ahead and put testosterone gel on to help their bottom growth. You're telling them to put the gel down there. There actually are some studies on this. You should look that up. And it's not recommended that you do that at all. It's very unsafe. It can cause rashes. It can cause blistering. It can cause extreme problems. Please do not do that. And I cannot believe that, once again, Plume's co-founder and chief medical officer just said that you can apply that there's no harm to try it. We don't have enough research, but go ahead and try it. Look up those studies.
What are some of the bad side effects or of testosterone? Like, what can be some of those or concerning effects that could be concerning?
Fortunately, there's not many.
Now, of course,
one thing, this was kind of alluded to in the chat here, and I mentioned this before, is that testosterone increases production of red blood cells. And a couple of numbers we look at called the hemoglobin and the hematocrit. Hemoglobin was mentioned in the chat. And so those are the markers of the red blood cell concentration in the body. And so it will increase that. And in almost all cases, it just bumps it up into levels where we'd expect it to be for a testosterone predominant body. But if there were, the thing that we might worry about is if it was like really, really high and could then potentially make the blood too thick and contribute to things like blood clots. But again, that would be extremely rare. In fact, there's never been a documented case of an elevated hematocrit as a result of testosterone, in a trans person causing an adverse event like that.
So what he just said is that there has never been a case of someone getting a blood clot from this in terms of a transgender man. This is wrong. I think I've seen personally 3 cases. I'm sure he has also seen these, since he is probably more well-read on the research than I am. But here I have a study that I found literally in just a couple seconds. Literally a couple seconds. I mean, I just took a tiny Google search, so it's not even hard to find. The case describes a 17-year-old transgender male treated with testosterone therapy who presented with an occlusive DVT, or deep vein thrombosis, of right axillary and subclavian veins. Testosterone level was 920 nanograms per deciliter, which is more than twice minus, at the time of DVT. And he had no risk factors for VT, none. So the thing is, I actually do have risk factors. I have blood clot.
So I wanted to let Isaac talk there because he obviously makes a great point. He finds a research study to prove them wrong in a 5-second Google search. Now, actually, heightened red blood cell count and hematocrit levels is actually extremely common for transsexual men. I have spoken about my own personal experience on how mine increased like crazy. I've already talked about how I'm on 3 blood pressure medications, and that I have to regularly donate blood every 2 months in order to keep my red blood cell count and my hematocrit levels in check. So to sit here and say that it rarely causes that, or that there's no case of that, is just ridiculous. I know it is literally one of the most common side effects of testosterone therapy. Once again, this is completely misleading from Plume. Completely misleading.
Those are usually related more to like pre-existing conditions or underlying medical conditions or diseases, which actually cause that number to go up way higher.
Yes, of course. If people have higher risk factors for those things, high red blood cell count, red hematocrit, that would happen if you have other medical conditions that contribute to that. But before my transition, I didn't have any medical problems. I literally had anxiety, and that was it. I didn't have high blood pressure. I didn't have any of the problems that I have now. So, and I've talked to many transsexual men who have had the same problem. It is one of the most common side effects. Seriously, Plume, get it together.